says live now. Yeah, go ahead. It's recording.
Okay. Hello, everybody. My name is Marianne. We are here at Dermatology Specialists of Illinois, and we are doing a live video about PRP, and we have a special guest. It's Dr. Khanna.
Hey.
So it's not often that I get to inject a hotshot dermatologist, so I'm very excited today. But I want to introduce you to the concept of PRP. Now, PRP has been used in medicine for some time now, especially in orthopedic medicine, because of the healing that it can ultimately promote. We are going to use it for aesthetic purposes to inject beneath the surface of the scalp in order to promote hair growth. Now, PRP stands for platelet-rich plasma. Platelets are involved in healing, and platelets ultimately break down and release growth factors. These growth factors will initiate cell proliferation and ultimately cause tissue renewal, and that's ultimately what we want here. Now, Dr. Khanna has had this procedure in the past and has already gotten some pretty good results, so he's willing to be the guinea pig yet again.
Yeah. So I had been injected by Marianne like a year and a half ago for the first time, and I couldn't tell that I got better initially myself, but my wife and my staff was telling me it was getting better. And then I came in for my photographs before my second injection, and it was actually pretty dramatic. And then I got my third injection, it was even more dramatic. So it's been very effective for me. It's usually a series of 3 injections,
Yes.
separated by between a month to 6 weeks between each one, and then once a year thereafter.
And I think that what we're really excited about is our PRP system is a bit above average, and that tends to be how things go at DSI. Dr. Khanna tends to have very good taste, and he tends to buy sort of the best on the market. And this particular process really gets rid of any type of contaminants. So if you look, this is what's been drawn from Dr. Khanna, spun down obviously, and you can see it's completely pure liquid gold. That's kind of what we like to refer to it as. You can see that there's no red discoloration, there's no contaminants, no red blood cells, no white blood cells. It's purely platelets. And the other PRP systems may not necessarily yield that. And so when you're ultimately injecting white blood cells and red blood cells under the surface of the skin, that's just going to promote inflammation. And that's definitely not what we're trying to achieve here.
Yeah, definitely. So when we look at it, when you look at the PRP, if you've had injections done elsewhere or you're looking at any PRP system, you want to make sure it's not pink. You want to see it's just liquid gold like that. And that means that you don't have contaminants that are pro-inflammatory, and they're going to counteract the benefits of the growth factor injections.
Now, Dr. Khanna, you had mentioned also that there is a matrix that causes some scaffolding that's really important as well.
Yeah, in this system that we use, it's sort of the new generation of PRP, which is an advanced sort of technology in PRP. We call it PRFM, which is platelet-rich fibrin matrix. So as part of the process, after the blood is drawn and we spin it down and then we put it through these filters, we're injecting a scaffolding as well as a fibrin scaffolding as well as the platelets, platelet-rich plasma. We're doing both. That allows the growth factors and the platelets to stay in place. So they're not just temporarily in there. They're going to stay in for days, weeks, so that we can then we can kind of get that benefit over time to really get those hair follicles growing back again.
So typically what we do when we have a patient come in, we ask that obviously you freshly wash your hair that morning. And we want you to be really well hydrated because we want to yield as much blood as possible to ultimately be able to derive those platelets.
That's a really good point. We've had I'm an easy stick today. I'm not always an easy stick, but like when you're dehydrated, we're not going to get. It's a little harder to get the volume that we're looking for.
Right. And the other thing is I'll usually tell patients to bring in like a hat to wear afterwards, a clean hat to wear just to protect the area afterwards. And typically we'll tell you to not go ahead and take any NSAIDs, so nothing that's going to thin your blood. If you have any discomfort, acetaminophen is perfectly fine. But let's go ahead and kind of show you what the process is all about. So of course, when we're trying to inject, and Dr. Khanna's kind of already, he's my boss, right? So he tells me exactly what he needs me to do. But he's kind of explained exactly what areas he wants injected. And so if we look at him, Right, he's got a little bit of that bitemporal recession, so we definitely want to kind of take care of these particular areas so that we can stimulate a little bit of growth. And he already is starting to have some baby hairs there. So if that fills in for him, that's going to be really great in terms of his final result. And then he's got a good head of hair here, but we want to really thicken it and kind of fill it in. So we're going to concentrate our time in this particular area. Now he has noticed that here he has more of, obviously less hair. We want to go around that area so that we can still get some fill in there, so that we can really kind of get him some really good results at the end of this.
It's like this is fuller here because of the PRP. I mean,
Yes.
that's when I had it done like a year and a half ago. It made a difference. I couldn't tell when combing my hair myself, and that was kind of frustrating at first for me. But it was the photos that we took here in the office that really showed me the results. I mean, it was like unmistakable. And then you're doing it a little bit more, and you realize, okay, this is working. It's like you can see it. It's noticeable difference.
And sometimes that's how it works with cosmetics in general, right? When you look at yourself every day in the mirror, you don't notice slight improvements. But certainly that's where the photos come in.
I think you're right, because it's like every day you see yourself, you're like, one day is not that different from the next. But at 6 weeks, it's noticeable. It was fuller, thicker, and with every subsequent treatment I got better. Now I'm a little lax. I should have been back about 3 months ago, probably, when I had completed my third treatment, after a year from my last treatment.
For that maintenance treatment.
But of course, I never, I just was busy seeing other patients and I didn't do it. But thank goodness Marianne's here today to do it for me.
So Dr. Khanna's got a Zimmer here, so this Zimmer is going to provide a little bit of pain relief. So it's just basically going to blow cold air at the area, because this ultimately is some pokes, some needle injections, but that cold air will help kind of relieve it and make it so it's a tolerable experience.
We actually have a question that came in.
Oh, sure.
Someone is wondering if it's able to work on the face to fill in beards.
Yeah, you can use it on hair follicles on the face too, to fill in the beards. You need follicles. As long as you have hair follicles, we can stimulate them to get thicker and bigger. So yeah, it won't put hair where there wasn't hair, but it'll make the hair that's there grow thicker, stronger, and better. So yeah.
And the great thing about this office is, we do cosmetic consultations all day long, and they're always free. And so we can definitely see you and confirm that you're a good candidate for this procedure, and confirm that you've got those hair follicles there that are present and active. And all we have to do is kind of reawaken them with the PRP.
Yeah. I have had this injection done, 3 sessions, and I can handle it. Like, I could handle it even without the Zimmer. But I like to have it in case, because it blows this, it's like personal air conditioning almost. We use it in a number of cosmetic procedures when, it's like a bunch of sticks, a bunch of needle pokes, and I mean the needles that you're using are small. It's fine, but I feel that this made it, like when I need it, it's gonna make me feel like I had something that I could do to direct it, like on the area where I was having. So I might intermittently use it during this today.
Okay.
So.
Great. All right. Okay, so we've already spent some time obviously cleaning off Dr. Khanna's scalp, and he's kind of already directed me as to where we want to do the injections. But we're going to go ahead and get started here, and then Dr. Khanna will let us know how he's doing.
I'm kind of a wuss with most things. Like I tend to be, I tend not to like shots. I tend not to like going to doctors. I don't like any of that.
That's pretty typical for most medical professionals.
Yeah, so, but I can handle this. I'm at the age now, I'm in my late 40s, and a lot of my friends are losing their hair too. It's not just me. I feel like I'm worse than they were. I was getting worse than most of them, but that's not necessarily true. But and a lot of my friends ask me about it, and a lot of people are interested. They're I think they're scared of the shots, but it's not that bad.
And when you think about the benefits, ultimately, this is a temporary procedure and it's a temporary process. And you can handle anything from a temporary standpoint when it yields good results for you.
Yeah. And there's some spots that it hurt a little bit more than others, but
Sure.
like, it's like there's probably a nerve nearby there, and it
And the
doesn't.
the good thing with the PRP, obviously, you're going underneath the surface.
Yeah, and we've treated now, I don't know, many dozen patients, and it's been overall pretty good. Not everybody gets the result from PRP. Now, some people come to us very, very late in the process, and they'll insist they want to do it, but the hairs are so miniaturized and so small, you may not get optimal results, and we see that once in a while. But in general, you could say about 75 to 80% of people are happy or very happy with results. There's about 25%, 20 to 25% somewhere like in that range, which are like, I know I'm better, but it still like didn't change my life. I don't know if I would do any more. And there's a few people that don't get any improvement. So you can never say never. Oh, that was a doozy, that one.
That one was a doozy. Sorry about that.
Do you feel like you need the Zimmer,
I think I'm
or
going to direct the Zimmer on there, but
Okay.
Marianne, I don't want to freeze your hand in the
Nope,
process.
you can do, no problem.
Okay, so, yeah, go ahead. Well, where are you there? Okay, I guess we'll have Vicky.
We'll have Vicky help us out here. It's certainly more nerve-wracking to have to inject your boss, right?
and this is a cosmetic procedure, right? Everything is
it's
not
not
covered.
covered by insurance. Yeah, this is a cash procedure, and we charge. Our normal price is $900 per session, and that's for a good amount of. It's for the two vials of the PRP, and.
Well, we're running a promotion in March also for our March Madness.
Yeah, right. And if you buy a package, we always have it. It's $200 off, and we have an additional $200 off this month. We call
For
it
a
March,
package of 3,
for
right?
a package of 3. Yeah. So it's for a package of 3 right now is $200. It's always $200 off if you buy the package of 3. So that's $2,500 for the 3, and then if you do it this month, it's an additional $200 off. We call it March Madness. We have a sale on multiple different cosmetic procedures every March.
Doing okay, Dr.
Yeah,
Nana?
I'm doing good. Actually,
Okay.
the Zimmer's helping me a lot first. And my tolerance goes down after I've had a bunch of shots, too.
Sure.
So it's like, it's like the first few, I'm like, oh, that's nothing. And then after a while, then I'm like, okay, I need a little break here. I need a mini break.
All right.
Okay, I just need a mini break here. And so you feel a little bit tender afterwards. I remember this from before too. It's like it's a little tender, and it'll probably be tender for like a day or two because we're injecting little aliquots of fluid in there, and it just stretches the skin a little bit. So you feel that little bit of tenderness, and also you have the needle poke too. So, but it goes away, and you could say in 2 or 3 days, it's like back to maybe even like 5 days. It's like a little bit tender to the touch, but you don't really notice it like most of the day. But then when you touch your head, you might feel it. But it's basically shots. We've all had shots before.
Did you you're finished?
I think
Okay, so it's quick.
It's a quick procedure. I think that sometimes, switching your needle out to a fresh needle, that always helps because the needle can dull over the course of time.
True. Yeah.
And so that's an easy way if you notice that the patient's getting a little bit uncomfortable, and we can do that to sort of provide a little bit of relief. But it is really a quick procedure, and typically we're talking and chatting throughout the process, and so it tends to be very well tolerated.
Yeah, and Marianne, you've done now, a lot of patients with it. What's your overall feedback from patients?
So I have done both male and female patients, and I think that the telltale sign of whether a procedure works or not is whether patients come back for that 1-year follow-up. When patients notice that they've gotten results, they book that 1-year follow-up appointment, and time again, I have patients coming to do their maintenance treatment. And they come and they tell me, I did notice results. I did notice a fuller head of hair. I'm so pleased, you know. And sometimes they do it, like you said, as an adjunct therapy. They may be on, you know, a medication or something to help with their hair therapy already.
Yeah, right.
But the PRP really boosts things for them, and so they've noticed, you know, a significant improvement. But when patients come back for that 1-year follow-up, that really is indicative of the fact that they've seen results and they want to maintain those results.
You know, and I think more people now are more interested. You know, it's a medical procedure, right? But we're also using your body's own natural healing properties, right? It's not like we're injecting like all this foreign stuff into my head. It's products made by my own body from my own blood that are being extracted out, and we're using that. And I think that goes along with what a lot of people like these days.
Yeah.
Like people want natural products, things that are not so chemically oriented. When we're injecting this, we're talking about the platelet-rich fibrin matrix, but it's fibrin. It's part of our own body and blood and our normal system. So it's our own platelet. So I think that's an appeal too.
That is.
Yeah.
And I think that, you know, ultimately what you achieve is your own, right? This isn't something that's going to kind of break down or wear off the way that, you know, Botox does wear off over a course of time and needs that sort of maintenance. But this is what you achieve on your own, and it's yours to keep and maintain over the course of time.
Well, yeah, so it's been a pleasure. Marianne's always a pleasure to work with. She has quite a following here at DSI. And it was painless. I feel fine now. I feel good, and I appreciate you doing it for me today, live on camera.
Yeah.
I'm kind of a wimp, so I did really well here.
So yeah, if anybody's interested in booking, you know, you can give our office a call or a text. We're text savvy to 847-458-7546. Yeah, so call or text us and we'll get you scheduled.